All right, welcome everybody to Health, the core response to the climate overshoot. This is being put on by the Climate Overshoot Commission, and I am Shandell O'Neill, pronouns they, them. I am a youth engagement member to the Overshoot Commission. Today we have with us Commissioner Kim Campbell, former Prime Minister of Canada, member of the Climate Overshoot Commission. We have Dr. Maria Neira, Director, Public Health, Environment, and Social Determinants at the WHO. We have Ms. Holly Ranaivozanany, apologies for that, Ranaivozanany, Deputy Executive Director of the Africa Europe Foundation. We have Dr. Thelma Krug, Chair of the WMO's Global Climate Observing System, former Vice Chair of the IPCC, and then we have me. And welcome everyone. To set a little context, I will give a little introduction to what brings us here today. In its report, the Climate Overshoot Commission listed the impacts of climate overshoot on public health. Across the globe, the convergence of more frequent and severe heat waves, droughts, wildfires, crop failures, storms, and disease paints a distressing picture of the escalating climate volatility. This pattern, fueled by the ongoing global warming and looming overshoot, portends mounting dangers to human health. Diverging from sustainable trajectories would imperil public health on a global scale, amplifying susceptibility to infectious diseases, malnutrition, mental health issues, and air pollution. Disease transmission dynamics would exacerbate, heightening the vulnerability of populations in Central and South America and Africa to epidemics like malaria and dengue fever, while those in North America and Europe face heightening risk of Lyme disease. The specter of undernutrition looms larger, particularly threatening children and women in low-income countries beset by food insecurity and climate-related disruptions. Moreover, the repercussions of extreme weather events such as wildfires extend far beyond immediate locales, enveloping vast populations in toxic smoke and haze. The stalling of progress induced by surpassing the 1.5-degree warming threshold would further indirectly imperil public health by undermining healthcare infrastructure and eroding socioeconomic stability, both essential pillars of community health and well-being. The global population is at a risk of mental distress the global population at risk of mental distress would increase, affecting those especially indirectly or directly exposed to climate impacts such as extreme events, displacement, migration, and poverty. This event is specifically targeted at discussing climate impacts and public health ahead of the 77th World Health Assembly, where discussions on strengthening the WHO's work on climate change will be debated through the climate change and health resolution tabled by a group of countries from all WHO regions. To Commissioner Campbell, starting off with you. As a former head of government and someone who has been a policymaker at the local, regional, and international level, where do you think health can act to influence the current trajectory of emission reduction, adaptation, and carbon removal? What understanding should we globally develop when it comes to the influence of health workers and of health public health professionals on climate change from the community level to the largest global health arenas such as the WHA?
Well, thank you, Shandell, and greetings to everybody, and how wonderful it is to be having this conversation. As one of the commissioners of the Climate Overshoot Commission, I remember getting the call in 2022 from Pascal Lamy asking me if I would like to be a commissioner on a Climate Overshoot Commission, and I said, what is climate overshoot and why does it need a commission? Well, I soon realized what it was all about when he talked about that we were getting ready to overshoot the 1.5 degrees Celsius goal we'd set in 2015 in Paris, and that I needed a commission to look sort of from 35,000 feet to look at the big dynamics, the big issues that we need to address if we have any hope of trying to avoid that overshoot, and what it might mean if we do overshoot it. And of course, now we know that people are talking about that the overshoot is here or is almost unavoidable. And yet when we started as a commission, there were many people who said, why are you talking about climate overshoot? We should be focused on meeting the 1.5 degrees Celsius goal. In the same way that people didn't used to like to talk about adaptation. They thought that was a bit, defeatist when we should be focusing on reducing carbon emissions. But the dynamic of climate change is forcing us to face all of these realities. when we did the commission, everything that we talk about when we're talking about climate change really relates to health, because we're talking about the survivability, not just of the human race, but of the whole the ecosphere on our planet. We're talking about life. And when it comes to human societies, so many of the devastating effects of climate change are impacted through the conversations we normally think we have about health. And I want to just say that one of the things that I've been most interested in, and this comes from being a lawyer and a former minister of government and a member of a government, is that I'm very interested in the ways in which the rule of law can be used to hold people accountable for creating barriers to dealing with climate change. I'm concerned about how fossil fuel companies have in fact made it difficult for policymakers to make good decisions because they've undermined the necessary constituency for good public policy. And one of the aspects of that I've been struck with is the role that healthcare plays in creating that conversation, that relationship of accountability. Last October, about a month after we had presented our report to the UN in New York, or in the context of the UN in New York, I chaired a global conference of the International Leadership Association, and I was asked if I would give a keynote address to a healthcare professional leadership conference. And it caused me to have some interesting thoughts. And one of the things that struck me, and I talked to them, I said, climate change is a healthcare issue. And you are on the front lines of this. Everything that you do is impacted by climate change. But one of the really interesting things is that when we look as people trying to make policy and try to figure out why it's so hard to make these changes, how hard it is to create constituencies for good policy, how much pushback there is from people who don't want to have the changes that are necessary. But one of the interesting things is that healthcare professionals, and particularly doctors, are still ranked as among the most trustworthy members of society. And the challenge that I posed to the healthcare professionals there was that you have a key role to play. I'm a lawyer. A lot of people don't trust lawyers. They don't trust politicians. They don't trust all sorts of people. But there still is a very high level of trust for doctors and people in the healthcare professions. And because the effects of climate change are right, these are the people who are facing it on the front lines. And even recently, we've learned that the survivability, the viability of viruses is directly related to the amount of carbon dioxide in the air. So as we're trying all of these things to deal with viral diseases and vaccines against COVID and whatever, the more carbon dioxide there is in the air, the more viable viruses are, the more dangerous they are. So there's no way that you can look at climate change and not see phenomenal healthcare implications. When I was speaking at that conference, and I was talking about how heat, which of course one of the main impacts, and I come from Vancouver, where people, it's the most temperate climate. And a couple of years ago, there was a heat dome in the Pacific Northwest, and 600 people in British Columbia died of heat. This is unheard of. This is a part of the world where people never had air conditioners, because you just opened your window and this lovely temperate air would come through in the summer. So people are starting to see the impact. But one of the things about heat is the destructive effect it has on our social health. That we see that when we start to have heat waves, we find that the levels of abusive posts, racist talk on social media goes up. And after I had spoke about all these ways in which climate change impacts on healthcare and how important it is for healthcare professionals to be aware that they're on the front lines and to understand how important this is for them, whether it is the changing vectors of diseases coming forward, all of these things. And incidentally, there's a gender aspect to that too. I was interested recently to see that women are more vulnerable to floods. You know why we're vulnerable to floods? Because our urethra is shorter than that of a man. And if we're in floods, we are more susceptible to urinary tract infections that come from being exposed to tainted water in a flood situation. There are all sorts of aspects of this that have health dimensions. So and one woman came up to me after my talk and she said, I now realize that climate change is a domestic violence issue. She said, I realized in recent years when we've had these climate, these heat waves, etc., that the level of domestic abuse goes up. So there, for all of the professionals who are concerned about our health, whether it's those who are doing research in labs, trying to figure out how to create vaccines against viruses and trying to understand how the level of carbon dioxide in the atmosphere may change the effectiveness of what they're doing, to people who have daily practices with people coming in more affected by the asthma, more affected by allergies, people who have survived extreme weather events, whether it's fires. Canada is right now polluting the atmosphere of North America with our fires in our great boreal forests that are supposed to be absorbing the carbon dioxide, but instead are creating all sorts of health problems for people with what they're doing to the air. I mean, every dynamic of it. So I think what we need to do, and this is not something that we dealt with explicitly in the Overshoot Commission because we were at 35,000 feet, but as we start to get more granular, as we begin to look at some of the other impacts or ways of looking at what we're doing, health is not only the front line of it, but it's an important vehicle for persuasion, for having the conversation. If you live in a country that has a public healthcare system, as I do, the costs of dealing with the effects of climate change are promising to break the bank. Because when people are already talking about that, the costs of dealing with the healthcare issues are actually half of what the cost to society will be if we don't. So healthcare becomes a prism, it becomes an entry point to talk to ordinary people about why they should care about global warming, why it matters to them, why climate change will impact them, why is their 6-year-old kid using an inhaler, because of air pollution, etc. But public policymakers, if they are looking at what are the costs of dealing with all of these healthcare issues, it becomes a no-brainer. So health, yeah, it's what it's all about. It's the front line of climate change, but it also provides us with granularity, with scenarios that ordinary people can understand, that ordinary people can relate to, and that can help to create the motivations for supporting, for becoming constituencies for good public policy, for supporting the efforts that people are making to deal with climate change, to push back against the greenwashers, etc., to have the right kind of anger, because it does affect all of us. Health is everybody. There's nobody, I don't care how rich you are, there's nobody who is immune. You may be able to afford fancy healthcare, and lots of rich people think they're going to create things that are going to make them live to be 1,000. Rots a rock. I don't want to live to be 1,000 if my planet is not habitable. But so healthcare, health, and the impacts on health of climate change are really important, both because of the dangers they pose to us if we do not deal with this overshoot, but also the vehicles they offer us to communicate with people at all levels in society, to create understanding, and perhaps the motivation to take action when otherwise they might not feel either personally motivated, or they might be selfish enough to think that their profit is more important than the health of the members of their family. So I'll stop there.
All right. Thank you, Commissioner Campbell, for setting the tone for today as well. Healthcare for a tool for accountability, trust in the healthcare profession, the cost of dealing with could potentially bankrupt all societies.
I should just add that that I said to these people at this conference, that if doctors have even a little poster in their office about climate change, if they make a point of talking to their patients about it, they can be hugely effective because they are so trusted. Because people, they might not trust other people, but if they see that when they go to Dr. Brown's office or whatever, that there is some information, there was a poster, and that clearly that doctor thinks it's a serious issue, that can be a very valuable form of communication and motivation.
Thank you again, Commissioner Campbell. No worries, we're not fully time crunch yet, but still trying to keep it moving. So next up, we have Dr. Neira. To you, I ask, the WHO has made significant efforts to raise the profile of health and climate debates, creating several incentives through a global strategy and alliance, ATACH. Could we ask for a brief state of affairs of both the climate impacts on public health, but also on the challenges encountered on the global health negotiations to advance climate objectives? And one more thing, it was kind of touched upon with Commissioner Campbell, I'd also like to take this opportunity of having 4 women panelists today to ask if you could give us an overview on the specific vulnerabilities of women and their access and the right to health due to climate change.
Well, a great pleasure to be with you, and thank you very much, Commissioner Campbell, for this very stimulating speech, focusing so much on the role that the health community can play. Obviously, I'm a converted. As a medical doctor, I cannot agree more with you. And let me then maybe explain why the climate crisis is a health crisis. I think the scientific evidence has been already demonstrated. There are millions, but certainly thousands of scientific papers describing the impact the negative impact that climate change is having on our health, from the change on the patterns of transmission of infectious diseases, dengue, malaria transmitted by vectors, waterborne diseases like cholera that we see now in Africa. For instance, we are seeing an increase on the cases of epidemic diarrheal diseases and cholera cases due to the water scarcity and lack of sanitation. Mental health, we are seeing now more and more negative impact on the mental health of our people, particularly the youth. We see as well heat waves that are affecting and killing thousands of people every year. We see how this is affecting as well non-communicable diseases, because the causes of climate change are as well overlapping on a 75% with the causes of air pollution. And air pollution is responsible for more than 7 million premature deaths every year, related to ischemic heart disease, related to a stroke, related to lung cancer, obstructive chronic pulmonary diseases. So I think we need to be very conscious that, yes, the argument that climate change is affecting our health is there, is not controversial, and is very strong. So now what? I am very much personally convinced that the health argument can be the one as well that can accelerate action on climate, as mentioned it before. It can be the positive argument that we all need. I think we need to work a little bit on the narrative associated with climate change until now. I think we have been, probably because it was very much needed and because of the urgency of the matter, using a very apocalyptic language. But now we need to use the language that will give some hope to our citizens, to our constituencies, in order for them to get more engaged, to put more political pressure on the politicians, to make sure that they vote the right mayors or governors, and to make sure that they will understand those connections and feeling that there is a role for them. There is something that each of us we can do. As the global health community, I'm convinced that if we use the health argument in positive, explaining the people that yes, there is a relationship between greenhouse gases and your own health. Yes, there is a relation, a linkage very strong between the causes of climate change and the air pollution and the fact that your child has asthma. When people is mobilized around protecting their own health, protecting the health of their children, then this type of mobilization is so strong, so powerful that is irreversible. So we are convinced that that's why last year at the health first ever health day that we organized it with the COP presidency, we have the opportunity to present the health benefits if you tackle the causes of climate change. One of the most immediate of a transition to clean sources of energy that are polluting the air we breathe and contribute to the greenhouse emissions will be the reduction on the diseases associated with exposure to the bad quality of the air we breathe. And that is fundamental, it's an incredible achievement for the health community. The second benefit will come from promoting healthy diets, sustainable food systems. If we want to tackle the causes of climate change, we need to promote a sustainable food system. And if we do so, we can reduce even 5 million deaths, premature deaths every year, due to lack of access to healthy diets, like lack of physical activity and sedentary lifestyle, and the association with the non-communicable diseases. And the third one will be the incredible benefit we can obtain from working at the city-urban level, working on ensuring that we have a sustainable public transport system that will reduce pollution at the city level. The cities are contributing to almost 70% of the pollution. That's why today I'm here at the Vatican, where they are having a summit between mayors and governments and high-level policymakers to look at how mayors can contribute to reducing air pollution, reducing climate change at the city level. And this is really very exciting because all of this will result on incredible positive outcomes for the health of our people. So we are fully engaged as a health community. We think that health can be the driving force, the motivation, the one that will unite all of us, the one that will not postpone anymore this agenda. You know, I'm a medical doctor by training. Imagine if we were in front of a big crisis from a public health point of view, and we were negotiating for 30 years about the solution for that. Can you imagine who will accept that from a public health crisis? Well, we are confronting a climate change crisis, which is a public health crisis as well. And we are now going to COP29, which means that for 29 years, our leaders have been negotiating the reduction of emissions, knowing that this is one of the biggest crises that we are facing. And it's taking 30 years. Imagine if it was a small crisis, what it will take. So I hope that with the health argument, we will be more ambitious and quicker on the solutions and positive. And I'm really convinced that we need a white coat revolution. And yeah, it's true that every doctor, every nurse, every public health officer, and anyone who feels that is concerned about health to promote these type of arguments and engaging more people on that and making sure we respond. My last point is that as the health system, as you know, we are responsible for 5% of the global carbon footprint. We have a 5% of carbon footprint as the health system. And therefore, we have put in place an initiative called ATTACH, Alliance for Transformative Action on Climate Change and Health, to green the health system and make our contribution to the decarbonization of our society. So thank you very much. We count very much on the networking, and of course the youth are golden in our hands, and this gold has to be used on the most powerful way, your voice and your engagement on a positive way. We don't want you depressed, we want you engaged, activist, and powerful.
Thank you, Dr. Neira, for your contributions. That was great, yes. And we spoke of moving towards more hopeful language and moving away from the dystopia that we were talking about before to help, lighten the situation and get more people engaged. All right, to you, Ms. Ranaivozanany. Sorry. You're working on advancing climate and health solutions finance, and it is not an easy endeavor. While over 90% of countries include health priorities in their NDCs, only 0.5% of multilateral climate funding is allocated to projects that explicitly address human health. Yet at COP28, a range of donors adopted the guiding principles for financing health solutions. How do you work on ensuring these pledges and commitments to turn into effective investments that reach the communities on the ground and at the right level?
Thanks very much, Chandel, and good afternoon, everyone. And I can only echo what Commissioner Campbell and also Dr. Neira actually mentioned before around this importance, obviously, that we had the first Health Day at COP, which is already, I think, a good sign, a good step, big step in the right direction. And that includes as well, obviously, this commitment around finance. I think I just wanted to start by saying that the partnership that we see between countries, climate, health funders, grounded, of course, in country and community leadership, will definitely be critical when we need to assess needs, look at foster demand, but as well looking at unlocking this investment that is much needed. But achieving this whole vision, of course, require lots of coordination, alignment, and collaboration across all sectors. And this is exactly the approach that we've been taking, particularly at the foundation. And looking at teaming up as well with different partners, including, for instance, Foundation S, to see how we can work best to really implement these climate health financing principles that were launched at COP28 to really ensure that climate vulnerable communities can first prepare, respond, but as well build sustainable health resilience, of course, looking at the impact of climate change that we already discussed before. So that means that together with governments, with multilateral climate and health funds, we're really now collaborating on thinking, articulating about these key learnings first that we see and the challenges on the existing funding mechanism, because we see that there is money is there, the principle is there, but how do we can also propose maybe new ways of that this funding could be easily accessible and directed to these climate impacted countries and communities. And of course, understanding at the same time the readiness of the country, the community needs, and how we can effectively ensure that finance is mobilized in the more efficient ways to those that need it the most. So this work has already been started. So we're going to have a conversation as well at the World Health Assembly end of the month in Geneva to see where we are, to kind of mobilize again the actors around the topic, and to prepare and present a piece of work in the next couple of months to advance and follow up obviously the work that's been done around these guiding principles. The second one, I think that is also important for all of us to see, is to explore the overall initiatives that we can see around this climate health finance conversation. And I want to take particular the example of the International Task Force that also launched at COP28 under the leadership of Kenya, France, and Barbados. And us at the foundation, we're very much looking at it at two elements. The first one is how to ensure that financing mechanism really trickle down to local levels, given the important role of cities in addressing climate change and implementing solutions, for instance, and that was also mentioned by Dr. Neira about the role of cities in particular in addressing this climate health perspective. And the second one is really thinking about it differently, looking at the cost and return on investment when we look at funding climate and pandemic resilience healthcare systems. And for us, the important aspects of looking at these different perspectives is very much to understand, when we look at climate finance, how do we ensure that there is a percentage, a fixed percentage of allocation that needs to go to health adaptation? Because I think, and you mentioned the data, Chandel, they're not great for the time being. I think there is a lot of work that we need to do within the communities, with the different partners, to keep on advocating that there is indeed within the climate finance that health adaptation funding that needs to go to that. And then maybe the final point I just want to put in to kind of drive a little bit the conversation is back to what Dr. Neira mentioned about the narrative. I think it's important that we maintain the momentum. So we talked, I think there's a lot of great progress that we mentioned and we've witnessed at COP28, but it's important to maintain that momentum around the climate health finance. So we recognize, of course, 28 was definitely a success on this front, but we need to keep advocating it, and even at the same time thinking of what additional innovative financing mechanism that we need to see out there, because the needs are immense. So we've seen as well that when we talk about even the different initiative, the allocation, disbursements, everything takes time. So and obviously the climate change is there, is around us. So we need definitely to ensure speed and scale. I think that's very important. So what it means about future-oriented models, financial models, that we can ensure this efficiency in investment, innovative practices that needs to happen. But more and more, and I'm back to my first point, it's about collaboration, bringing the right stakeholders around the table, and the heart of it, obviously, the communities and the countries that are particularly vulnerable to this. So I'll stop there. So back to you, Chandel. Thank you.
Thank you, Holly, for that contribution. I really like we have to look into the benefits, because I think the benefits in resilient systems will pay out in the long run, even though if it's a high capital cost in the beginning. All right, and finally to our last speaker that hasn't spoken yet, to Thelma. The IPCC has issued throughout its assessment specific chapters and findings on health, adaptation, and vulnerability. But it took decades up until the last COP28 to have a healthy and a focus where ministers of health were convened to understand and act more directly on climate impacts. Why did it take so long for political decisions to listen to science? Why didn't member states of the UNFCCC see the benefit of addressing health risks, even if health is a part of the convention? Why didn't members of the UNFCCC see the benefit of addressing health risks, even if it's a part of the convention's objectives?
Yeah, thank you very much, Chandel. And yeah, let me give you hopefully a brief response to this. Obviously, the IPCC addresses health, I would say, not in specific chapters, but as well in potentially all the chapters from all working groups, even the physical basis of climate change, and then impacts, adaptation, vulnerability, and mitigation of climate change. But not necessarily all the science that is on the table on the 8,000 pages of the IPCC assessment reports in the last cycle, are immediately embedded into the negotiations. I have been a negotiator myself for many years. And I must say to you that obviously I welcome the idea that elements like, health, like forests are individually treated or addressed as health was addressed at COP28 during the Health Day. So I welcome that. But I like to see a also more holistic approach when addressing specific issues. What do I mean by holistic approach? So a single issue like health, which is across all the chapters, as I said, is related to mitigation, is related to adaptation to climate change. But I would like to reinforce the idea that it's also linked to sustainable development and the sustainable development goals. So looking a little bit more holistically, not only, singly at health, but, how it is integrated into the sustainable development policies. Maria, and I'm very happy to see Maria and King here, everyone giving, very important inputs into this discussion. And Maria already addressed the issue of the air pollution. So we sometimes concentrate on CO2, but we forget to remember that black carbon, for instance, carbon monoxide, non-methane volatile organic compounds, they are emitted during combustion processes from cars, from trucks, from airplanes, but also in wildfires, and also very importantly in the household activities, in particular in Africa, which use such a traditional cooking with open biomass burning. These are very detrimental to human health. Maria brought some statistics. I think she has more updated statistics than we had in the IPCC report, but it doesn't matter. The number that we had in the IPCC, which was 3.3 million premature deaths in 2010 from outdoor air pollution, is already very significant. So reducing the air pollutants in the context of climate policies would lead to substantial co-benefits. Chandel, I would also like to stress that sometimes we refer to human health, but we cannot forget that health is also associated to the animals and also associated to the ecosystem. So I would like to enlarge the discussion. So we need to understand that climate change may also affect the animal health management practices, and potentially leading to an increased use of pesticides or veterinary drugs that could result eventually in increased levels of residues in food. So I think that, looking more holistic at health, not only humans, but another issue that I would like to reinforce, Chandel, is the following. So when we are talking about addressing health, And in particular, in developing countries, and this is why I'm linking to sustainable development and to sustainable development goals, is the fact that you have, in particular in developing countries, a lack of sanitation, a lack of drinking water. You have not necessarily good public transport, also not, sustainable buildings. So you have several sectors that in particular for developing countries would need to be also addressed. So when we are talking about mitigation and adaptation, measures or activities or policies, we should be looking as well on how to address all these issues, all these sectors, buildings, transport, water, which are interlinked with the Sustainable Development Goals. It's not easy. It's not easy. As it has been already said, air pollution is bringing many diseases already from other pollutants, not only necessarily those big greenhouse gases that we normally talk about, like CO2, methane, N2O, very much related to land use activities and change. But I would just like to reinforce the need for us to look a little bit more holistically, and how could we support countries through international cooperation to overcome the issues of sanitation, drinking water, which are very much related to the many illness that have already been indicated by the previous speakers. I will stop here.
All right, thank you, Thelma, for that contribution. I really like the remembering a holistic approach, remembering animal health. Even though we like to talk about public health, we forget animals and the impact of all those veterinary antibiotics and everything. Also the impact on wash and clean cooking. Dr. Neira, I see your hand up. The next question is to you, actually, because we know you have to leave early. So if you could just take it all together.
It's just because I want to go to this point of holistic and integration. I cannot agree more. As a physician, they train us to see our human body as on a very holistic way. So we know that if we fix a little problem of blood pressure, we might not fix another one. So we are very conscious as physicians of the holistic approach, the importance of looking at the human being as a human being, not just fixing different diseases with different specialties. So Thelma, I fully agree with you, and I like very much and endorse what you are saying. We are not promoting a narrow sectoral approach, not at all. At the contrary, as the health sector, what we are saying is that the Paris Treaty, if implemented, it can be the best ever public health treaty, because all the recommendations that are included there are nothing else than basic public health interventions: access to safe water, sustainable public transport, more sustainable food systems, reducing traffic, and promoting a different source of energy, a non-polluting source of energy. I mean, all the interventions, even on the green spaces, the agriculture, everything will have an impact on the human health and animal health in most of the cases. So I completely agree with you. What we are saying is two things. One is that the health argument can be used to accelerate these three critical transitions that are needed: transition to sustainable sources of energy, transition to healthy, sustainable food system, and transition to healthy urban planning. We can help you on that because we can be the holistic approach that is needed. Nothing motivates more people than the health. And my second point is that what we are complaining a little bit in terms of health is that the health system is already coping and absorbing a lot of the consequences of climate change, and is mentioned everywhere in all the national determinant plans as a consequence of climate change. But then the health system, the healthcare facilities, the ministries of health at the country level are not receiving, as you know, the funds are less than 0.5% for health, even if health is very much attached. So those 2 points, but I fully agree with you. Thank you. And thanks for the opportunity as well.
Well, fortunately not for you. I know you have to leave soon, but the next question we had to you was along those specific lines of what does the WHO specifically need as policy and funding and technical tools who work with the health community to overcome overshoot?
Well, I think our strategy is very clear in WHO. We keep producing scientific evidence. It's our mandate, clearly. We need to engage ministers of health and the health community at large. The global health architecture needs to be involved. We need to give recommendations and guidelines as the guidelines for the air quality. We brief at the indoor air pollution. The clean cooking is absolutely fundamental, and the ambient air pollution. We have to engage with networks of professionals that can respond to this. And of course, we need to equip our health system. Our health system is now not prepared, not equipped to be climate resilient. And for that, we need resources, because the health system becoming climate resilient is fundamental. We will decrease our own carbon footprint, but we need to respond to the emergency that climate change is creating in terms of more outbreaks of infectious diseases and more non-communicable diseases as well. As you rightly said, it's not just infectious diseases or respiratory diseases. The spectrum is huge, and particularly when we look at the issue of pollution in general. So we need political support as well. That's why we are going to the World Health Assembly now with a resolution. We are going to COP again this year with a very big day. And we count on all of this movement to make sure that the health of the people is very much at the center of the negotiations on climate change and health. Not looking for a sectorial approach, but looking for what is uniting all of us together, and which is more tangible for our citizens, and something that they recognize as more maybe motivating. Over, and thank you again.
All right, thank you, Neira. That was great. All healthcare systems need to become climate resilient. It's a very comprehensive message. We're getting into the second round of questions now, so I'm just asking everyone to try to keep it short so we could hear from everyone. To Commissioner Campbell, as stated in my introduction, the Climate Overshoot Commission has listed climate impacts on public health, identifying direct and indirect biggest threats to humans. Nonetheless, the Commission has not discussed health in its recommendations, even if at all the care agenda is about health. As a commissioner that has a track record on engagement in public health, public and global health, what can you share with us on the deliberations among the group, and why hasn't health been more visible and better articulated in the recommendations?
Well, I think, Chandel, that healthcare was the backdrop of so much that we did. I mean, it is so much the raison d'etre for why we care about climate change, and our focus was on climate overshoot and how that could be avoided. And health was only one of the areas of serious impact that we didn't get into with great difficulty. For example, because you could talk about, social disruption and social disintegration and, chaos on that level, in terms of governments and peace and international relations. I mean, all of these things are also spin-offs or vital issues that are affected by climate change. And also, just going back to when Maria was talking again about healthcare and ecosystems, we also didn't get into a lot of the issues about extinctions and the disruption to the whole ecosystem of the world, although that's a sort of an understood part of it. I think what we are doing now in the Climate Overshoot Commission is talking about where we go next. And should we simply work at trying to make our own recommendations more accessible, clearer, more directed? Or should we expand to perhaps look at some of these other issues that are deeply integral to what we were looking at, but that we did not have the space or the time to look at in any specific in depth, much as we would have liked to, because there are a number of major issues that the future of the world and human society depends upon in terms of dealing with climate change. But I think with healthcare, I think, as I say, it's the 800-pound gorilla in the room, the health. I mean, we are looking at the survivability, as I said at the beginning, not just of human beings, but of our whole ecosystem of life. And there seems to be a kind of willingness on the part of some people to be kind of indifferent or complacent about what that balance of life forms means for the world. And we see this now where, species are going extinct, species are moving because of climate change and coming into new areas and, destroying the native fauna of a certain area. And then this is affecting the balance of nature. It's also affecting the ability of farmers and other cultivators to grow their crops and provide them with, there's all sorts of things. And that relates not just that relates to famine, in terms of whether we're going to be able to feed ourselves, but also to the kind of balance of how we use the world. So I think our next goal as a commission, and we're talking about this now, is to try to decide. We have identified some themes in papers that we will do, but I think the important thing about the Climate Overshoot Commission was that I think we also realized that it was important for us to do what we thought others were not doing, which was to provide a comprehensive kind of, as I say, 35,000-foot overview of the big issues and directions that we need to go to keep to the 1.5 degrees Celsius limit if we possibly can, and to understand why that's important. But climate change is the biggest issue of our lives, and it breaks down into so many small issues. And that is why there is nobody in the world, nobody in a society, no matter how modest you think your life is, there is nobody who does not have an important contribution to make in terms of how they live their lives and the things that they know and the things that they try to care about and advocate for, because it is such a complicated issue. So I don't know whether my fellow commissioners will decide that we want to branch out in more depth there, or but for example, I've been with our chair, Pascal Lamy. We've had a couple of meetings in Geneva with heads of major organizations, the World Health Organization. We've met with the High Commissioner on Refugees. In other words, we've met with a lot of the World Meteorological Organization. We've met with a lot of organizations that are working on pieces of the climate change puzzle, because we think it's important to know what they're doing. And the World Health Organization was one of the ones I met with the director the first time we went to meetings there. And so we are connected, but I think it's also important to do what you're doing and what you've defined as your particular goal and do it well, understanding that you are a tile in the mosaic of the big picture of the understanding. And if you can make your tile as effective as possible and as sound as possible, then you can contribute to the understanding of the big picture. And if you decide that you can then perhaps address another facet of the issue effectively, it with some kind of impact, then I think you can do that. But I think that it is one of, there's an old saying, don't let the perfect drive out the good. That sometimes people will say, well, yeah, but you didn't do this. No, but we did do this. And this, nobody had done that before. And that's what we set out to do. So, but that's where, our youth engagement group, and incidentally, one of the things I would say about our youth engagement group, which was such a, Chantal, yourself and your colleagues were such talented and interesting people, and very knowledgeable. I mean, there was nothing, there was a lot of in-depth knowledge that came from your discussions. But I would say that one of the things about health is that our awareness of what climate change means for life expectancy, for the ability to thrive, particularly in terms of future generations, that this was something, your participation raised the visibility of that, but it became a very important part of how we thought about the issue. And that's why I don't understand the greenwashers, the people who push back. I think to myself, what do they say to their grandchildren? Do they really think that their grandchildren are going to thrive in a world with that pollution, with heat waves, with floods, with all of those negative things? So the generational justice side of it was perhaps the other side of the coin of health and human and species survivability as being what the issue was all about. but you may have some very important contributions to make to us and to goad us to address some issues that we didn't address, in detail in the first go round, that you think maybe we're ready to tackle. And that's why we pay you the big bucks. I'm just joking. We don't pay any bucks. None of us get paid any bucks.
Okay, I like how we made that little joke right there. Thank you. Thank you. Shameless plug for the youth engagement group. Yeah, we worked hard, and I like to call us the Power Rangers, standing up to power and all that kind of stuff and trying to do good. I just want to say we have a few questions, but we leave that to the end, and hopefully our speakers who are still left on can just hang around for a couple extra minutes, please. Thank you. And so the next question right now is to Holly. Civil society voices have always proven pivotal in providing the needed impetus to provide complicated global issues providing the needed impetus to move complicated global issues forward. In adaptation, mitigation, and climate finance, what is still missing to attract the attention of key policymakers and constituencies to the devastating health consequences of climate change and the impending overshoot of 1.5 degrees Celsius? What are the mechanisms required to empower communities and civil society and to ensure their voices shape the global and national discussion on climate and health?
Thanks, Chandel. I think when we talk about communities or civil society organizations, it's very important that we have representation. Representation matters, inclusiveness matters, and we need to sit at the table. When we talk about all these global initiatives, may that be climate health financing guiding principles, may that be a conversation around the reforms of international governance systems, when we look at this new initiative around global tax force, for instance, initiatives following the Paris summit last year, when we talk about finance for development in particular, there's always, I think, a place now that is dedicated for civil societies and for communities to express themselves and also share their needs, their expectations, their concerns. And I think this is very important, that we need to give that space, but it is not just a space for a space to chat. It's also a space where we need to see action that are followed up, that are monitored, because it's great to have commitments, but beyond that, we need to see where the action goes. So I think that's very important. For this to happen, obviously, we need the political will that Commissioner Campbell mentioned before. We need also, and I think most and foremost, this cluster approach, because I think bridging the silos discussion, may that be on mitigation or adaptation, I think definitely needs to happen. And we need to have this kind of a comprehensive overview of options for action. And the communities need to be at the center of it, because they're going to be the beneficiaries, obviously, of this funding and on this action. So they need to be the heart as well on this decision-making process. So whatever it's been, let's say, cooked internally by multilateral, by funders, by other partners, when we look at these climate health issues, I think it's important to look at it at a co-designing type of approach, looking at the locally led solutions. Then we need policies that has to be fit for purpose for this. I think what happened in one country may not necessarily be the case in another country. Needs are different, approach needs to be different, tailored accordingly. So that's why you need this local organization, this civil society, grassroots communities to be at the center of it and be fully engaged. And that to happens as well, you need a frank conversation. You need that safe space where we can share knowledge, but obviously look at this action and different responsibilities as well, and accountability, so that and that is particularly clear for health in particular. And then maybe a quick last point. I really like to echo what has been mentioned by you, Dr. Krug, around clean cooking. Clean cooking is definitely one of the examples, if I may say it, really at the nexus of climate health development, and examples of issues that are at the heart of what we talk about today, and that we need to discuss, because it's at the heart of the communities. And clean cooking is, of course, not yet at the level, of course, that we expect in terms of investment. And we were very happy for a couple of days ago when we have the first Clean Cooking Summit in Paris, where we announced a 2.2 billion investment. I think that's really a great step into the right direction. But we need to keep keep in mind that particularly in sub-Saharan Africa, we still have 1 billion people that lack access to modern cooking solutions, and almost 500,000 people actually die prematurely because of household and pollution every year, household issues. So again, looking at specific examples led at community level where we see that it already shows solutions, action-oriented. This is probably the way to go that we need to foster. And that is, again, back to what I mentioned earlier, it's about maintaining that momentum, talking about it, looking at what narrative, you mentioned about what is still missing. It's that strong narrative showing that there are solutions that already exist, that we need to scale up, that we need to speed, because looking at the issues that we're facing today, but it's again looking at how do we ensure that we connect the dots, that climate people to speak about, on the food systems that we discussed about, transportation, on energy, on health, obviously, that is all interconnected because we're looking at obviously global, more development issues. Thanks.
All right, thank you, Holly. I really appreciated your contributions again about co-design for local and global and fit for purpose. Also, I noticed you mentioned the task force. I know Barbados was on it. I'm a shameless fangirl for PM Motley, so anytime you mention Caribbean or anything like that, yeah. And yes, clean cooking is very important. I'm pretty sure there's a gendered aspect to that, but I'm pretty sure we could get to that in a question and answer. The final question we have for the panelists today is to Dr. Thelma, sorry. Assessments have been made on health adaptation and mitigation, and the consequences of global warming on health has been largely explored. But what do we know about the impacts of technology such as geoengineering, including carbon capture and the removal, as well as solar radiation modification on public health? Do we know enough? Do we have enough evidence on the threats or any benefits? And if what is required to assess the risk they carry?
Okay, thank you very much, Chandel. I'm gonna try to be brief. And in being brief, I'm gonna respond quickly to your last question. Do we know enough? No, we don't know enough about the technologies. But I'm gonna concentrate first on solar radiation modification or management, because this is potentially the one that is most contentious. But we know things because the IPCC has been increasingly addressing, CDR and SRM in the reports because there is more literature available for the authors to assess. But so starting with potential benefits, do we know if there are benefits from the SRM, for instance, options? We have to see that solar radiation modification is not a single alternative that you have. You have several options underneath this, I say, portfolio underneath. So we have been studying some of the potential benefits. If I link it to health, the most direct impact of a warming climate is increased morbidity and mortality due to extreme heat. And perhaps the health impact most likely to be ameliorated from the implementation of an SRM strategy. So this is the positive side, right? So it can ameliorate the temperature. So this would potentially reduce, morbidity and mortality due to extreme heat. Another issue that it would be positive, that increases in the ozone formation that is caused from higher temperature would be expected to be reduced. And in particular, we are talking about one of the most studied options under the solar radiation modification, which is the stratospheric aerosol injection. So potentially the increase in ozone formation caused by higher temperatures could be reduced, let's say, or potentially or expected to be reduced with the stratospheric aerosol injection. But we also have other things that result that are not so positive. For instance, from the stratospheric aerosol injections, we would have more particulate matter would be from the injected aerosols, changes in the radiative forcing. So there are issues that we do not necessarily know enough to be confident that these technologies could be deployed, in particular SRM, which I said, it's a portfolio, several options, but each one with potential risks and benefits and costs and maturity. health impacts from wildfire smoke exposure could also be reduced. But, the studies show that in some areas, this there could be increases in smoke exposure, also limiting temperature increases by solar radiation modification could reduce some health impacts related to waterborne disease driven by extremes in temperature and precipitation. But some simulations show that in some regions this does not work. So what we see is not consistent benefits everywhere. And one of the issues that I would like to raise here is the need for us to enhance research on all the options of SRM in particular, but be more, attent that we need to engage researchers from the developing world, which is from the studies, potentially Africa could be very much affected from changes in precipitation that would affect agriculture, economics, and so on. So need more research. Some benefits have been highlighted, but also not consistent benefits everywhere, and also issues that we don't know enough. In relation to CDR, well, CDR is inevitable because it has been included in basically all the models that have been assessed by the IPCC to limit warming to 1.5. But there are issues like land competition from large-scale implementation. Let's say large-scale reforestation would impose, land competition with agriculture. This could raise the prices of food, could also stimulate migration, especially from local communities that are, and indigenous peoples as well. So another one of the options under CDR, carbon dioxide removal, biochar particles that would be released during the production, during the transportation and distribution of biochar could also affect air quality and health. So we are learning, Chandel. I think there will be many more publications upcoming in this cycle of the IPCC assessment. But I would say that this should not refrain us from already initiating research. And as I said, please engage everyone in this research and not only, researchers from the North that have more financial means to be supported.
All right. Thank you, Thelma. I really appreciated your contributions on remembering that we have to include the Global South in these conversations because, again, if the research is mostly in the Global North, they'll have a Global North bias, and we don't want that in this kind of solution. Right now, we wrapped up with the formal part of the panels, and we will be jumping into a question and answer session based on the questions from our audience. I'll ask them kind of two at a time because, well, these two are kind of related. Somebody asked, can we elaborate more on women's vulnerability and climate change, as well as how can women be empowered to respond to climate change-induced challenges to their sexual and reproductive health and rights? Anybody?
Are you addressing this? Well, I mentioned something earlier. I think that women are disproportionately affected by all sorts of phenomena in the world that are also linked to climate change. So whenever there is some factor that disadvantages human societies, generally speaking, women are disproportionately affected by it, partly because they are less powerful in their societies, also because they are more likely to be the victims of violence. And as I mentioned before, one of the things we know is that extreme heat actually increases the level of violence in a society. It actually increases the levels of domestic violence from which women suffer. All sorts of ways in which women, because they have responsibility most primarily for looking after their children, their own well-being is complicated by the needs that they have to look after their children. So there are many ways in which the relative lack of power that women experience in many societies. But what is interesting is that in societies where people look for community-based solutions, women are often a hugely important and valuable resource. that they often understand, they have skills, they have knowledge based on what they do in their communities and the work they do, whether it's growing crops or organizing or whatever, they can be hugely powerful. So when we look at dealing with climate change, that's why I mentioned before that one of the other big issues that we didn't talk about was the whole issue of governance writ large. That not just the governance of things like SRM and other policies, but that the empowerment of people and the empowerment of women is a very important feature of our ability to tackle climate change, because women make important decisions, or they educate their children, but they also often have resources and capacity to behave in ways or conduct their lives in certain ways that help to mitigate climate change. And the whole question of clean cooking is a very important one. If women will buy into new technologies, then they will take root. And there are some wonderful examples and stories in countries around the world. I think some, Africa, and even in the developed democracies, where women see an issue, take it, and work to mobilize their whole communities. So they are disproportionately affected by many of the negative aspects of climate change. And I mentioned this interesting one about urinary tract infections, which, because of women's physiology and that their urethra is shorter than that of a man's, that when they are exposed to tainted water, and I see sometimes the pictures of people in floods and they're waiting around and thinking, oh my God, what's in that water? Because we know that sewage systems have been disrupted and flooded. So floods are not just bodies of water that can destroy buildings, knock you off your feet, drown you. They also carry contagion. And women are often more susceptible to some of the contagions that are carried, just because physiologically they're more vulnerable. So there are a whole lot of ways, and I think that one of the most important things about it, and I would say that our Overshoot Commission operated on the basis of a very strong respect and gender respect in terms of the members of the commission and what we look to. But if we can focus on those issues as well in the terms of the empowerment of women and allocating to women the rights to make decisions about their own lives, the payoff will be an enormous contribution to our ability to deal with climate change, because they are on the front lines in so many different aspects of behavior that relate to emissions and adaptation, etc., that not to capitalize on what they can accomplish and not to empower them to do the things they're capable of doing is unbelievably self-defeating, as well as being cruel and unjust and not right.
Maybe.
Apologies.
Then
I know
could I quickly contribute to that? Could I quickly?
Actually, just I know Holly has to leave soon. So if Holly could just have one last 2 seconds to put in her intervention, and then we can have you, Thelma, please. Thank you. Okay. Sorry.
Thank you, Dr. Krug, for your understanding. I just have another meeting, so just maybe one quick word to kind of emphasize about the role of women as well in kind of driving this locally led new solutions. And the example of clean cooking, I think it's very clear when we see that women are the one in Africa in particular that prepare the food, and they need to have that safe and clean and affordable way to kind of to do so. So I think the solutions that have been brought out there, like countries like Kenya or Sierra Leone, under the leadership of this woman that really take the lead, show the ways, and also kind of embrace, I think, this new, what we call delivery units around clean cooking. I think it's a great example that we need kind of to learn on. And I think the idea is more to see how we can scale up basically this type of successful stories driven and led by women to kind of inspire kind of others to do so, because we've been talking about clean cooking for many, many years, but we've seen as well that it hasn't really kind of fly somehow. So how can we build on these specific examples to make sure that we can really address this issue and address at the same time climate and health? And maybe a very quick point on the questions that more around how do we get access to this finance and to reach out the communities. I think this is exactly the work that we're doing right now. It's about translating the pledges, the commitments that were announced at COP28, what it means in practice. It's about mobilizing the different stakeholders, the communities, the global funds, obviously they've been working on these issues, and also the prioritization. Where do we start? Which communities, which vulnerable countries that need to have it first, and how we can test as well in terms of pilots. So that's the kind of approach that we hope to provide in the next couple of months with the different partners in a very inclusive approach to ensure that we can adapt this. So thank you very much, and apologies I have to run for another meeting. Thanks everyone. Yeah.
Thank you for your time. All right, and Thelma, back to you.
Yeah, I was going to add to Ken, and thank you very much, Ken. You have been very comprehensive and balanced, as well as Ole. But I just wanted to say, how do I see some advances on the issue? Like the IPCC, in many parts of the reports, includes women, elderly, and children as the most vulnerable under climate change. So it is, those population. But when we are looking also now, when we look at the UNFCCC and some of in some of the reports that have to be submitted, let's talk about the nationally determined contributions, the NDCs from countries that have to address gender. I don't like to see gender as looking only at women. I think it's broader now. But if we look at the NDCs and how they are addressing gender issue, they are talking about inclusiveness of women in the decision-making process. Well, that's interesting, but that's in paper, right? So the difficulty is, how do we go from paper, from indicating how they believe they are going to include women in the decision-making process, in the construction of policies that can have a direct impact and effect on their lives? This is to be seen. But I really appreciate the opportunity that gender, and let's say gender, being looked by the countries as mainly looking at women, is already a good step to empower them if they are included in the decision-making process. So it's just calling for that. Women should know what the governments are putting in the NDCs, and calling for that inclusiveness that is there from many aspects. So that would be my contribution. I think we are improving.
I like that. Just being informed is a tool for empowerment for women. I'm getting the call to wrap up now. Apologies to the questions we didn't get to in the chat. I will take this time to thank all our panelists today. Dr. Neira, who had to drop off, Ms. Ranaivozanany, who had to also leave, and also thank you to Commissioner Campbell and Dr. Krug for your time today and your expertise and sharing everything you had to us. You can find out more information on the Climate Overshoot's website, and also check us out on social media. I know we have a LinkedIn, we have a Twitter/X. I can't remember the last platform, but there's another one there. So just check us out and you can find out more information. We have annual reports and see what more to come under the CARE agenda. So thank you everyone, and